And this morning we were talking for so long, and then what were the words you came up with, that phrase we said?
Well, I think the most important part is that it's about so much more than the diagnosis, the being HIV positive. It's about who we are as people and how we treat each other, and how all people have dignity. I think that's really core and center of what we're doing. I'm not really an HIV/AIDS person myself. I've been working on development issues, more generally, poverty alleviation, etc. But obviously, HIV comes up in that work quite a lot. And what I've been thinking while listening in here is that we need to, just be able to find ways of communicating and listening, so that we see, our friends as our friends.
People ask me when I go and visit people living with HIV/AIDS, what do you do? And I think more than anything, I just listen, and from that I learn. And then, as you know, in that kind of role of ambassadors, you're a messenger, aren't you? And you go and you push that message onto whatever platform that you and I have. Different platforms, of course, but we have our own, and that's how we use it. And the thing that I learned is that HIV/AIDS as a physical disease is the first disease. So you get your diagnosis and you think, I've just been diagnosed with this. And then the second disease is the one that lasts. Because today the physical one is treated by so many medicines which are developing right now as we speak. And you can live, this is what we have to tell everybody, that people living with HIV/AIDS are living with HIV/AIDS. They're not dying
Exactly.
of it. And so we've got to stop treating them as,
that.
Always in newspapers they always say hospital patients, sufferers, victims. They're not. They are empowered, especially if we help restore that kind of dignity, whether we happen to be HIV negative or not.
Well, that's the sort of double thing, that you both get a diagnosis of a disease, and then you have to face that, which is tough enough. And in addition to that, you got to face stigma and discrimination and all the fear that comes with the territory. Someone said yesterday that it's we're not victims, we're survivors, and I think that's a good way of thinking about it. It's something strong and powerful that comes out of that experience.